Hello, I'm Dr. Ryan Kazemi, and welcome to our weekly hints and tips in dentistry. In this episode, I'm going to share a simple treatment strategy that will save a significant amount of time, money, as well as number of visits for patients who have failing dental bridges and are looking to get dental implants to replace them. It is not unusual that teeth supporting bridges develop recurring caries and have to be extracted, as is this patient in this case. So in such cases, the first thing we have to do is section the bridge. Next, the offending tooth that is infected or has caries is extracted and grafted if necessary. Patient then returns in about 3 to 6 months later, expecting to get dental implants. The only question remains, do we have adequate bone to support the dental implants where the teeth were previously missing? The answer is we don't know. So in this case, if the bone is deficient, we have to graft the site. Patient has to wait another 4 to 6 months for the healing and then return to get the implants. This adds to the treatment time and of course the number of visits. So my tip for patients who have failing bridges and are anticipating getting dental implants for replacement, and in order to minimize the number of surgeries, as well as decrease the treatment time and also number of visits, are the following. First, get a cone beam CT scan, a CBCT, in order to analyze the supporting bone and also the extraction site and have an accurate plan for the grafting. Second, plan for the bone graft in the extraction site as well as the sites of the missing teeth, if necessary, all at the same time. This way the surgeon can plan the grafting in the extraction site and the areas where the teeth have been missing to perform this in one stage and have the patient ready for dental implants. Third, replace the missing teeth with implants all in one stage. This way the patient can only go through one surgery for grafting, one surgery for the implants, and have them ready for restorations 3 months later. Here's the same patient with a cone beam CT scan showing the tooth that was infected that has to be extracted and grafted, but it shows excellent amount of bone that does not require grafting. In this case, the patient can have the extraction and the site graft here. 3 months later, the implants can be placed, no surprises, and very short period of treatment time. Here's another patient with a failing bridge. This tooth has recurring caries and an infection and has to be extracted. A cone beam CT scan is done, which shows the abscess on the tooth that needs to be extracted, and also the area where the missing tooth is. There's moderate amount of bone loss. We know that we have to do moderate amount of bone augmentation in order to develop the site for implants. So here, we will plan to extract, place a minor graft in this site, and have the areas ready for the implants in about 4 to 6 months later. This way the patient only goes through one surgery for the grafting, again, another surgery for the implants. Another patient with a defective failing bridge. This tooth in the front, again, is non-restorable and has to be extracted. When we do the cone beam CT scan, it shows that there is a significant amount of thinning of the jawbone that you could not otherwise see in a regular dental x-ray. So now the patient can be presented with a very precise plan to graft these areas, develop the site adequately, and then come back and put the implants in ideal position and deliver a set of teeth that the patient will love. So again, let me summarize my tips for patients who have failing bridges anticipating to get dental implants, and in order to minimize the number of surgeries, decrease the treatment time, as well as the number of visits. First, get a cone beam CT scan. Cone beam CT scan is a 3-dimensional imagery, and it is the only way to accurately diagnose the bone in anticipation of the implants. Dental x-rays are simply inadequate to provide this data. Second, it's best to plan the extraction along with the grafting in one time. That way the patient can only go through one surgery to develop the areas and get it ready for the implants. All the implants can be done at the same time, decreasing the treatment time, number of visits, and a much happier patient. Thank you for watching. I'm Dr. Ryan Kazemi. See you again soon on the next Hints and Tips in Dentistry.